Hello, everyone. Welcome back to Quantum Healthy. We have Kelly Bento back on the podcast today, and this episode is going to be all about dental health, quantum dentistry. And if you would like to go back to listen to the first episode we did with Kelly, that is actually episode 12, which I will link in the show notes. But just a quick introduction of Kelly. Again, she is a quantum hygienist with prior experience, both conventional and biological dentistry. She's also a fellow graduate of the Institute of Applied Quantum Biology, and she has a very keen interest in quantum biology and red light therapy. She's also the founder and CEO of Soleil Well, a company selling high quality red light therapy units and blue blockers. And that is really what we covered back in episode 12. We really took a deep dive there with the red light. So if that interests you, go back and listen to that. And of course, she is a quantum mom, and that's actually what she's known as on Instagram. And yes, our last episode, actually, Laura was not with us, and so it's with me and Kelly, actually. And today, Laura is with us, as per usual. But yeah, so Laura, I'm going to let you go ahead and start.
Thank you for coming on, Kelly, again. I have a
Thank
feeling
you for having me again.
yeah, again, it may not be your last. Today, again, we have so many questions and we may not get to them all, and that's okay. Right. First of all, I was really sad to miss your last recording. Yeah, it was a rough day for me. I was in the ER and I'm still recovering 9-10 weeks later, but I've graduated
Oh,
to one
goodness.
one one crutch. So that is the good news. But I thought the two of you did a fabulous job together. So, and I've actually heard from many people. It's one of the most popular episodes. I've heard from a lot of
Oh,
people, yeah, on our podcast on red light therapy. So everybody who hasn't heard it, go back and catch that episode. But today we're going to talk about the mouth. And I've heard you call it this. I love this term, quantum dentistry. Can you just start by defining what it is and maybe what it's not, like, and how different it is from biological and conventional dentistry? And obviously you are a dental hygienist, so you're seeing it from that perspective.
so biological and conventional dentistry, there is a lot of overlap as far as, procedures, things like that. Where they differ is in materials, but they both have shortcomings in that neither of which is addressing the light issue in with their patients in its application in dentistry, but also in the clinical setting. They're not addressing doing these procedural dentistry under the proper light, which would have a huge benefit to the patient as well as the practitioner in that environment. So with me, I do practice at a conventional practice, but within my operatory, it is very much quantum dentistry. And, I've met so many people through this community that I actually have people from this community drive, 3 hours to come and see me to be their clinical, dental professional, which is really very humbling and certainly, makes me feel very good about the work that I'm doing, that people are that committed to it. But it is about, quantum dentistry is about providing the proper environment to treat the patients in for the best clinical outcome. But also it's in addressing, all of that lifestyle environment that that could potentially be affecting the patient in a negative way. So a lot of that I address, when I intake of a new patient, always in my health history, I'm addressing, what is their light look like at home? How much time are they spending outside? Like, these are really, really important things that should always be addressed by any healthcare professional, whether that be medical or dental. That's a huge, huge, implication as far as what their health is going to look like. And that's a huge opportunity as well in opening that conversation and always addressing the importance of light in their medical or dental health.
Do you see yourself as a pioneer with this? Like, do you know any other quantum hygienists out there? Do you have any colleagues?
No, I am one, I guess.
Yeah.
My hope is certainly to bring those that are in biological dentistry that are doing some good work. My hope is to bring biological dentistry into this space. I will tell you, even just in my conventional, allopathic dental practice, that many of the operatories now, many of my colleagues within that practice are adopting my ways within their operatory, because, and this has been moved forward with the patients speaking up for themselves in leaving my operatory and going into another that may be, very lit, and walking into that space and saying, oh, those lights are offensive. Can you shut those off? That doesn't feel good to me, being in this room, being under that offensive LED lighting. So I think it's really interesting, as well as also my colleagues honestly themselves even feeling better when they shut off those LED lights. So things are moving, I think, in a good direction, but there's a lot of work to be done. And I think once people start recognizing, and also as a patient going into a practice, any practice, medical or dental, certainly speaking up for yourself and asking for that practice to provide you with the environment that is going to work for your biology, by asking them, shut off those overhead lights, please. And you could say, well, they prompt me to have migraines, or things like that. There are many different ways of wording it, but giving the patient the the verbiage and the power to walk into a practice and to ask for an environment that is going to support their biology.
Full spectrum light environment. And we're up on the term malillumination, because we had an interview with Ken Cedar, who worked with John Ott, and those were his two terms. So we discussed that a lot in an interview recently. So, okay, so I guess the question would be, how did you personally come to this? Were you looking at your own health and concerned about, because we've heard stories about dentists, that they're more likely to get, I've heard this, Parkinson's, some neurological things, and we automatically, I always jump to the mercury issue, but heavy metal issue. But so the question is, were you concerned about your own health? But I also know, as the quantum mom, you're probably looking at your kids, and they're now going, seeing hygienists. Yeah, where did it come from?
Well, I always say that people will come into this space either through crisis or curiosity. Hopefully it's through curiosity. For me, it wasn't so much a personal health crisis, but it was my brother's brain injury that really pushed me much deeper. I had already been curious in quantum biology through the work of Jack Kruse. I had followed him for a very long time, and was always intrigued by the whole light conversation. My kids had grown up wearing blue blocking glasses and things like that. So I was definitely curious, but then having a loved one have a very serious health crisis, it just threw me way down the rabbit hole on this. And also, that's what ultimately got me to go very deeply into red light therapy. So, whatever it is that brings you there, hopefully it's curiosity and not crisis, but whichever means brings you there, it's a fun ride.
Right. Okay. All right. So many questions. Okay. Just on the safety aspect, just to finish that.
Right.
Yeah. Just, can you touch on mercury? Some of us have still, I don't know. Do you, Andeea? Mercury amalgams? Mine, two of them were removed, but I'll just give a quick story. It was like a month after that, I had a cyst on my breast. It was down in Alabama, and was scared, but I was luckily in the States, because they got me in the next day and to a doctor. That wouldn't have happened here in Canada. And I found out, oh no, it was just a benign, not to worry, but it's the first time I've ever had a cyst on my breast. And then within a month, I went hyperthyroid, and that triggered it was bad. I was really hyper. So I still always wonder if that, taking those two out, and it was early days. This, what it would have been, 2004, maybe. So it was pretty
Yeah.
early in the removing the amalgams. I don't know if that, the safety was done, but yeah, what are your thoughts on that? Should people rush to get them out or keep them in?
I don't think anyone should rush to get them out because we just, I mean, it sort of, it depends. I
Yeah.
should say that.
It always
It
depends,
does,
right?
right. It does depend. Everything is an N of one and every situation should be looked at independently. I never like sort of blanket statements like this is the way it should be for everyone. But I personally still have 4 very small amalgams, amalgam mercury fillings in my mouth. They are very small. I had every opportunity imaginable being in a biological dental practice to have those safely removed, in a, practically $1 million smart room that could do like, it's called smart mercury amalgam removal, where they have the proper evacuation system, all of that. I made the I feel educated choice not to have those removed because, again, biological dentistry was not taking into consideration the light. So, what I've heard, what I've learned from Dr. Jack Cruz is that blue light excites mercury. So if you are touching a mercury amalgam filling with a high-speed drill and you are vaporizing that under blue light, you really don't have any real idea of what exactly is happening. So I wanted to just be as conservative as possible and not thinking that I was doing something very healthy by having them removed in a smart room. I just don't feel as though we know enough or it's understood enough within any dental office what exactly is happening, where exactly is that mercury going. So I just made the decision not to move forward with that. I think until biological dentistry, supports the light conversation, I will continue to keep my silver amalgam fillings.
Okay, just on that, before we get into preventative again, I got a couple more questions. Just to throw out there, are they ceramic? I think so. Back to that event, they replaced them with 2 ceramic.
Yep.
So it's been 20 years.
Yeah.
Do I just wait until it's not like, do these things ever have to be replaced, or do we expect that they'll only last 20 years? Do you know?
I mean, they always like to sort of assign an expiration date to certain things. Yes, they would say, well, they're expected to last 10 years, they may last 20 years. Here's the thing. Your redox potential is going to dictate all of this, all of it. So if you maintain high redox, which is general health, right? If you maintain good general health through good quantum practices of sunlight, of grounding, of good food and good relationships and all of that, you probably throughout your lifetime will not have any issues with those as long as they were, done well, as long as the actual, clinical side of the dentistry was done well, then I don't feel as though, you'll have any issues.
Okay, I will sleep better tonight knowing that.
Yeah.
Okay, so you and I were both on a year-long masterclass, quantum masterclass, which was
That
just
was amazing.
wasn't it? Thank you. Thank you to you, because you're the one that said, Laura, this is an opportunity.
Yes.
You need to do this. And then there were times when nobody showed, and it was Corey Yasmini and Carrie Bennett and I thought, I was like, will somebody pinch me? Because I'm just able to ask my
Right.
questions, and oh my God. But of course they had all the recordings out, but
Right.
oh, those 2 together were just brilliant. And
Absolutely brilliant. Those
brilliant.
2 are magic.
They
Yes.
are. And of course in the class were some very, I won't say everybody that was there, but yeah, some very high profile people were there. Is Corey, I want to say this is Corey taught you, or maybe it's Jack Cruz, but he talks about teeth as being semiconductors. Could you explain
Yes.
that? Yeah.
Yes. So when I heard him say that, then I went a bit deeper and teeth. And then of course, Jack started into the whole melanin being a semiconductor.
Right.
Teeth are considered, there are two types of semiconductors. There's P type, which is a positive type semiconductor, and N type, which is a negative type semiconductor. Teeth are considered to be N type semiconductors. They are conducting electricity within the body, which is that's a really important job.
Yeah.
And I loved analogy in considering teeth to be light bulbs. And when you unscrew a light bulb, you're cutting off that energetic pathway, which that just blew my mind. That just brought so much of dentistry into such an amazing understanding of its importance. We've been taught that, teeth are expendable. Oh, that's bothering you. Just pull it out. Same thing with wisdom teeth. Oh, we're sending 14-year-olds to have wisdom teeth extracted before they ever pose an issue. First of all, there's no consideration as to whether or not that child actually has the jaw structure to support having those wisdom teeth. It is just an automatic blanketed treatment plan that every kid gets sent to the oral surgeon to have those wisdom teeth extracted. That is a really, really bad idea. Both my boys, they're 19 and 24, have their wisdom teeth. My husband has his wisdom teeth. So, they serve a purpose. There is a very important reason for those wisdom teeth, and they need to stay. And I've been, sort of counseling my patients and, do not rush to the oral surgeon. There are circumstances, I will say, that does indicate that they sometimes do need to be taken out. And again, that's everything is an N of one. Every situation, every person, every jaw is a different situation that has to be thought about. But this, this just sort of sending everyone to have them taken out, I think is really, it's a very bad idea.
Right. Because they conduct electricity. Right. So you're taking out maybe a connection to the next part that conducts the electricity. Yeah.
Right.
Yeah.
Right.
Oh, interesting. I don't know if I'm a freak of nature, but I was told I was evolved, but I disagree. I think now that I'm learning quantum stuff that I was born without, or I don't have any wisdom teeth.
Well, and that's also something that's really interesting that's happening that no one's really talking about as being something like, wow, we should really be paying attention to that. Is that yes. Dentists like to say, oh, well, we're evolving into this higher species that we don't have wisdom teeth. They're called wisdom teeth for a reason. We're supposed to have them. They are very connected energetically. We really are supposed to have them. And the fact that we're sort of evolving without them is, I think personally, not a positive signal.
Yeah, it makes me wonder about what went on in my mother's diet, maybe, or is it my palate? I didn't breastfeed. There's all kinds of interesting, but my kids were born with them, so I didn't pass it on. So I'm happy about that. But
that's interesting.
Yeah, which is interesting, right? But okay, let's talk preventative dentistry and best practices. Okay, so if we start with the hygiene and cleaning section, which there's tons to go there.
Right.
If we talk, I guess the first big question would be, do you have toothpaste? Do you have any favorites? Do you use toothpaste and fluoride in particular? I wrote down, studied Carrie Bennett's 3 things that she mentioned. Maybe I'll mention them to start. What she thought were negatives was they're kind of the fluoride's a mitochondrial toxin. So yeah, it's not, your mitochondria don't love fluoride. Compromises the collagen network of the body. So that's another big negative. And then Jack Kruse always talks about the fact that it lowers your dielectric constant, which is basically
huge.
The ability of the body to store energy and water. So
yeah.
So beyond those 3, can you tell us your thoughts on fluoride toothpaste? And then if you don't love it, what are alternatives?
Yeah, I do not use anything with fluoride. I also do not live in a community that has fluoridated water. That's for a reason. That systemic fluoridation that they're adding to water is very much toxic. There are enough studies out now. Finally, they're actually recognizing the issue with doing that. finally. I do believe that it is directly tied to, osteoporosis and hypothyroidism. There are so many things that it is directly linked to, as well as, and this is a fully published study, as well as showing that it lowers IQ in children. This is a really, really bad idea that we were sold to be a health benefit. No, it's, like a lot of things, you find out, you get a certain number of years down the road and go, oh, wait a second, well, that was a really bad idea. So I do not use fluoride in my home. My kids do not use fluoride. I don't support it. The practice that I do work for, they do support it, but it is definitely, it's always a conversation that I have with my patients, and my patients have always been made well aware that I don't use it in my own home. I don't use it for myself or for my own children. And that is a decision, an educated decision that I've made for my health and for my children's health. And then I give them the tools for them to make their own decision, whether or not they choose to use it. But again, they typically will always kind of, refer to what my recommendation is, which is not to use it. It's not preventing cavities. It is not doing what you're being told that it's doing. From a prevention standpoint, from a dental hygiene standpoint, first and foremost, living this lifestyle of grounding, of sunlight, of not being overexposed to blue light, absolutely supports your oral health. And it doesn't require as much work to maintain a healthy mouth when you're maintaining a healthy system. So everything that gets sort of discussed in the world of dentistry, and having to have your teeth cleaned all the time, and having to use fluoridated toothpaste, and having to floss every day, you find living this healthy way, those things are not required. Your body is a self-healing mechanism that doesn't require anything external in order to maintain its health. I'll say it, I went at one point, I think I went about 7 years without having my teeth cleaned. I did not need my teeth to be clean. My gums were pale pink, and my gum tissue was tight around my teeth, and I never had any bleeding. And I did not need any form of dentistry in order to maintain my health. I was taking care of that with my lifestyle choices. Nutrition is a huge factor. That is a big part of dentistry, of proper oral health. So that's one area.
And we'll talk more on that.
Yeah, that's one area where I feel like dentistry is doing a good job. But ultimately, from a brushing standpoint, yes, the mechanical action of brushing is useful and necessary to remove any plaque that may have built up. So, I always support brushing your teeth. As far as flossing, again, like, I'm not a huge for flossing with the floss that is available to us. A lot of it is made out of plastics. A lot of it is coated with chemicals that you do not want to be introducing into your mouth. We're finding out we're all full of these, forever chemicals and plastics.
Right. Microplastics.
Microplastics. And by pushing those, with floss down into the sulcus area around the tooth, which has a direct line into your bloodstream, I don't find that to be beneficial. I find that to be definitely a net negative. So, if you feel as though you need to floss, I always recommend getting something like a natural fiber, something like an organic thread, even just a woven cloth organic thread. They
use silk.
Yeah, silk.
I have
again.
silk,
That's
yeah.
a natural fiber. Those are things I can support using. Anything that's plastic and coated in plastic is a very bad idea.
I've used
Which will be all your mainstream flosses.
Right.
Yeah.
I ordered, Sarah Kleiner talked about, I believe it was Risewell, and I ordered their
Mhm.
floss I was getting their toothpaste, and I got the floss. Oh my God, it's lovely.
Yeah.
So here's the question though, because I just got the one, I tend to reuse it. Is that a bad idea? Like if you, is the
I
vacuum?
wouldn't do that because you're using it to basically to disrupt
Yeah.
what happens with plaque is it is a colony of bacteria that forms, and it's forming every minute of every day on every one of us. So it's this colony of plaque that has this matrix, and the goal is to just sort of disrupt that matrix, right? And kind of clear away some of the plaque. So, you know, reusing it, you just don't want to allow an opportunity to kind of to reintroduce.
I know. That's what I worry about.
Yeah. To just, you know, if you're going to use floss, use it and just throw it away.
Okay, I have to get a cheaper brand. Organic. I'm gonna go look at my threads and see. Like you're talking about thread, like sewing thread?
Yes. Yeah. If you can
Okay.
find like an organic thread, as long as it fits. Some people have very tight contacts in their teeth,
Yes.
and so it doesn't fit, but it's worth a shot. It's inexpensive, totally natural,
Yeah.
easy to use. You know, listen, 200 years ago, we didn't have floss and we were fine.
Yeah.
So
exactly. Yeah. Our diets were very different though. Yeah.
exactly.
Yeah.
Right.
Yeah. Okay, let's go to toothbrushes. Soft or hard?
Soft, always soft.
Okay, because you can damage the gums or?
Yes, that's also a big problem that we see in dentistry is overbrushing. Overbrushing, I will tell you, is a much bigger issue, creates much bigger problems than underbrushing. So overbrushing, people tend to be much too aggressive. They're actually brushing away gum tissue. You know, when tissue is traumatized, it's going to tend to retract and try to retreat from the trauma. So overbrushing, you're causing the gums to actually recede, and then you're exposing part of the tooth structure that is never meant to be exposed, which is the dentin. And that's a much softer tooth material as opposed to the crown of the tooth, which is made of enamel, which is the hardest substance in the body. It's about 50% more mineralized than even bone. So when you're exposing the dentin, that is a very susceptible area. So once you start, it's called abrasion. So once the gums have receded and the root surface of the tooth is exposed, it's very easy with it, even with something like a toothbrush, to brush away actual tooth structure. It's very, very damaging, and it's not correctable.
Oh, okay.
Yeah.
Ooh, we got our lesson there.
That's a big, big problem in dentistry, and that is something that we can't correct. And it's far more susceptible to decay because it's a lot softer. It's only, like I said, it's only 50% as mineralized as the crown portion of the tooth that's covered with enamel. So, you know, the issues that arise from aggressive brushing are, you know, and for a lot of people, they can actually be catastrophic and result ultimately in tooth loss.
And I've been encouraged to brush my gums for lymph.
Yeah.
Is that a good idea? And is there a right way to do it? Should you brush up? Andeea, you were telling me earlier, you brush upwards? Is that
Yeah, Kelly, I used to be a very, like, one of those people who really thought the more I press, the more I'm cleaning my teeth. And yeah, and I had a dentist tell me, you know, that. And I also have just full disclosure, everyone, I had receding gum line also from my bulimia. So, you know, that also fed into it. So yeah, I take the softest bristle brush I can, and like basically when I massage my gums, I guide them down. And I also have to be better at using your torch, which we'll get to. So I'm actually treating my mouth with that as well. But I mean, I have not had any complaints. And you know, when you do the numbers thing, I always have good numbers.
Good.
So I know I've corrected it, and that bad habit went away. But I know my dad was a really hard brusher, and I don't know if I picked it up from him or what, but it was something that got stopped early enough, I guess.
Yeah. I think with a lot of people, I don't think that there's like a genetic component to it, but there's definitely like a personality component to it, right? Like if you're just like
Well, I meant more
you know,
like I watch my dad behavioral,
right.
yeah, no,
Right.
not like genetic.
Yeah.
Right.
Here's a question. When should we brush? Like, should we wait a while after we eat? And should we not brush too often? That's what I was taught
Yes.
more recently, to brush just a couple times a day. I don't know what you
Right.
think of
So what I do, there's a lot of interesting information in discussing the oral microbiome and the gut microbiome. And there's this belief that the oral microbiome is actually supposed to populate the gut microbiome. So waking up in the morning and going immediately to the sink and brushing your teeth with toothpaste, you're wiping out all of that bacteria that is actually, you're actually supposed to be swallowing that to populate the gut microbiome. So what I do in the morning is I come downstairs and the first thing that I go to is my Quinton minerals, and I take a swig of the Quinton minerals and I swish that around for, I don't know, 30 seconds to a minute. I just swish that around, sort of pulling the minerals and bathing my teeth in those rich minerals, and then I swallow. So then anything that, may have been within my oral microbiome, I'm then populating my gut microbiome, and I'm also, just sort of adding some minerals into my teeth, because that's the function of saliva, is in providing the minerals, bathing the teeth in minerals, whether the teeth need them or not. Like, so sometimes if the teeth need minerals, it's almost like the parotid gland functions within the mouth, almost like a pancreas functions within the system of the body. I learned that through some of Jack Cruz's work, and I thought, well, that's really interesting. I've never heard anyone in dentistry discuss that point of view. So
provides enzymes, like the way the pancreas.
Exactly. It provides digestive enzymes. Digestion starts in the mouth. It starts with your saliva. It starts with your saliva producing the protease, and the lipase, to break down any food that you eat.
So with tongue scraping, I know a lot of people do that. Obviously, if you're tongue scraping right in the morning, it'd be just as detrimental to those healthy bacteria. So when would you do you recommend people use a tongue scraper, and when would they do that?
I like tongue scrapers. I think that they're useful. I would do that after I would get up in the morning and I would maybe have a glass of water, or like I said, I use the Quinton minerals. Any one of those things, as long as you're just sort of swallowing anything that may have, been populated on your teeth throughout the night. And then I brush my teeth a little bit later in the morning. And that's also when I would suggest doing some tongue scraping. Some people, depending on my schedule's a whole lot easier. I'm home most days, so I get to dictate my schedule. So I'm able to do that. But I certainly understand people have to get up and they have to go to work. So, my recommendation would be just the first thing, don't just barge into the bathroom and brush your teeth. Take a minute, drink some water, some mineralized water, some salted water, or something like that. And then just, certainly make sure that you brush your teeth before you leave the house.
Sure. I actually heard you talk about that, and I use Soleil water, but I've been doing that, and it just goes to show something I've done my whole life is wake up, go into the bathroom, brush my teeth. And,
Right.
It's just, you think about these everyday things that we don't think, we actually think, oh, that is a good habit to have, and
Right.
how it can actually be, contributing to that compounding, bioaccumulation of this modern world we're living in, and how,
Right.
by
Bad
just doing that
habits.
one thing, we can actually balance our gut microbiome out. So very interesting.
Okay, on tongue scrapers, that was making me think of the tongue. Is it true that did I hear you say this, that the tongue emits the most UV light
Yep.
in the body?
Yeah. First of all, the
Wow.
tongue is the strongest muscle in the entire body.
Yep.
So it's like, it's fascinating that it is this like life force within our mouths that emits more light than any other, you know, organ or anything within the body. The tongue is so, so important. And we just sort of dismiss it as it's just the tongue, right? In Chinese medicine actually addresses the tongue quite a lot in, you know, in diagnoses. They typically will look at the tongue and they'll map the tongue and, you know, decide, you know, what herbs that person needs, or there's such a fascinating area. I know Amber has a whole course on like mapping the tongue. And I mean, it really, it's something that, you know, as a whole, we tend to not really talk about, but the tongue is really important. I believe it to definitely be like one of the life forces within the human body. It's so powerful. It's our means of communicating, right? It's our means of showing love to one another. It's really, really important.
I used to have my tongue pierced, and when I took it out finally in my 20s, my tongue was closed up within probably less than 2 days, because I actually went to go put it back in because I was like, oh, maybe I don't want to take it out. And I went to put it back in and I couldn't put it back in. And I was like, well, I guess the decision is made because I'm not getting it re-pierced.
Right. Which is a good idea, because you don't want to be drawing any sort of, you know, frequency towards something metal in the mouth.
Yes, exactly.
Good point. I was going to ask you what you thought, but I knew it would come out.
Right.
Mouthwashes. What's the nitric oxide connection?
Well, again, it's the microbiome. So within the mouth is where we actually produce a certain percentage of our nitric oxide. So, you know, we're basically just blasting that and removing all of that
ability
from the mouth just by using these absolutely, you know, horrific antimicrobial that they're like napalm. They just kill everything. They just absolutely kill everything. It's almost like taking like an antibiotic daily, but you're doing that within the mouth. And like I said earlier, as far as the digestion starts in the mouth, the entire digestive tract runs from the mouth to the anus. So anything that happens in the mouth is going to have an effect all the way through the system.
So it could cause constipation, for example.
I mean, I think, well,
or IBS.
I think that, there's definitely a correlation between Crohn's disease, IBS, and your oral health. Without question, I see that very often.
Okay, interesting. Okay, Waterpiks. Are you a fan?
Nope.
Not a fan.
Nope.
I've used them when I've had like a blueberry smoothie, and then I look in the mirror and I can see all the little blue, you know, and it's a quick way to get out the door. You don't have time to brush your teeth. You're not a fan. Tell us why.
Not a fan. I feel as though so around each tooth there is a turtleneck, like a collar, a turtleneck of gum tissue, right? And then there is about anywhere from a 1 to 3 millimeter space between where that gum tissue attaches to the tooth and the tooth. So if the tooth is sitting in the socket, you have this little tiny space in between. I feel as though Waterpiks tend to drive bacteria that it normally would have stayed more on the surface. I feel as though Waterpiks tend to drive that bacteria deeper into the bottom of those pockets, which that can further create a periodontal issue, you know, an attachment loss issue where the gums start to actually pull away from the teeth.
Geez, you're decluttering my bathroom with your answers.
Right? Just get it all. Just go outside. Just go outside.
Just go outside. What about oil pulling? What do you think of that?
I'm okay with the oil pulling. I'm okay with that.
Okay.
Do you think it's worth all the effort?
I personally don't. I don't oil pull because I find like that is a lot of effort. And again, living this way, I don't feel that I need that. I feel as though my mouth is kept healthy just by living this way.
I love that answer because see, you know, when we learn, when we get introduced to all of the different things, like, and we want to be healthy, people will just, they'll take on so many things. And a huge theme with like quantum living, quantum lifestyle, being quantum healthy, if you will. Yeah, we don't need all of that stuff. It's almost like, yeah, you need to do all of that stuff maybe to get to a certain place of health, because
Right.
then, yeah, when your mouth is really healthy, you're not going to need X, Y, and Z because
Mhm.
your mouth is healthy now. Like, there is a place
Yeah.
where we get healed, where we don't
Mhm.
have to continue on. And I feel like I've learned this the hard way. You know, I talk about being recovered in recovery. You know, being in recovery is working a recovery program, but we can be recovered. And when we use that, if we don't use that word, for me anyway, I'll speak for myself. I always thought that there was healing that needed to be done. So I was doing every single little tiny thing that I would hear about. I thought I needed that, even though I didn't really technically get tested for that. Like, oh, a liver detox. Oh yeah, I should do that. When I technically, like, do I need that? I
Right.
probably don't. And I think that just in this day and age, with how our world is and people trying to sell us everything, it's really easy to just fall prey to, you know, well,
Right.
they said this was the healthy thing to do, so that's what I'm
Right.
going to do. And then sooner or later that leads into a habit, brushing the teeth every single morning, like we were talking about.
Yeah.
So
Yeah,
anyway, I
interesting.
digress.
Okay, I think my last one before we hit dietary, and maybe this is dietary, but xylitol rinsing, like a gum or a mint, or just taking real xylitol and rinsing your teeth.
Oh,
No,
that gets a thumbs down as well. We should have done
does.
a thumbs down, right?
Okay, tell us why. Okay.
Well, xylitol affects the microbiome,
Yeah.
affects the oral as well as the gut microbiome.
Even if
Not,
you spit it all out, you don't
I
try
mean,
rinsing and then spit it. I don't swallow it.
if you're rinsing, again, everything gets absorbed, especially
Mm.
in the mouth. That's why we do, sublingual medications. Everything
Yeah.
gets absorbed at even a higher rate when you're talking about within the mouth. And also, within the buccal lining of the cheeks, like the mouth is just this space that, like, everything just gets absorbed through the tissues.
Mhm, mhm.
So I tend to my go-to is just eliminate all. Just keep it as absolutely simple
Simple.
as possible. Once you've established that your redox is good, on your way there may be things that are needed. There may be more interventional and sort of medicinal things that are needed as you're getting there. But once you're there, like, staying in health is a whole lot easier and a whole lot simpler.
Did you ever tell us what you brush your teeth with? That was the question.
A lot of times I use just water. It's
Just
just a
water.
simple, mechanical action of using a very, very soft, natural bristle toothbrush. And, I do like just a slight little, like, refresh kind of feeling. I mean, I think we've all become more conditioned to that. So I do use, honestly, just the tightest little skim of hydroxyapatite toothpaste. That's it. If anyone is struggling with any level of sensitivity due to, there are many reasons, years of aggressive brushing, grinding your teeth, there are all sorts of issues that would lead to tooth sensitivity. You're struggling with tooth sensitivity, I find using a toothpaste that's based with hydroxyapatite the greatest answer. But here's the caveat to that. You brush with those toothpastes and you spit them out. You don't rinse them, because you actually want that mineral, that hydroxyapatite, which is what teeth are actually comprised of. They're made of that. You want that to be taken into the teeth in order to remineralize and desensitize. So that's the key to using a toothpaste like that, is to brush with it and then spit it out, not to rinse it out. You could wipe your tongue down if you need to, but rinsing it off is you're then, like, eliminating the important part of it, which
The
is
minerals.
yeah.
Yeah.
Minerals.
I've used Living Libations toothpaste a long time, and I know that's one of the ingredients in it. And it comes in such a small little jar. But yeah, you
Yeah,
do not need a lot. It just
Right.
comes, or doesn't come with, but she sells a little spatula, and you hardly need any on the spatula to
Right.
feel it. And and it doesn't even foam.
Right. Well, that's the thing too. Most toothpaste contain sodium lauryl sulfate, which is
sulfate.
horrific. It's terrible. So
Yeah.
many people react to that. I see every single week, I'm seeing someone that is having some level of a reaction within the mouth. And I'm constantly saying, get rid of your toothpaste. It's the sodium lauryl sulfate. Get rid of it. It has no place in the body.
Yeah.
Yeah, agreed.
So, we've done all these the preventative measures, and you have a wonderful torch that, like, what is the benefit of what will people see when they use the red light therapy in their mouth?
Well, I mean, from a dental standpoint, I will say I have found red light therapy to be the greatest tool available to me as a practitioner for my patients who maybe don't have their redox up to where it needs to be. Red light therapy it's absolutely phenomenal in treating nearly anything that I have come across clinically in practice. So I've told this story on other podcasts before. One of my patients is one
I'm
of the
kissing.
oldest. Hey, hi.
Hello, power ladies.
He's off to Greece, so I have to kiss him. Okay, we can cut that out or not, but
Yeah, no, that's wonderful.
I had to say goodbye.
I almost had my son peek in so I could kiss him goodbye, but I just gave him like the little sly wave. So yeah,
So
so
like-
one of my patients is one of the oldest living diabetics in the world. I mean, this woman actually was treated, her doctor was Dr. Jocelyn, who was the founder of the Jocelyn Clinic, which is the world-renowned diabetes clinic here in Boston. So, this woman has been a lifelong diabetic, and her teeth, obviously, I mean, her entire system suffers, but her teeth certainly had suffered, and her gums just bled profusely. Her gum tissue was so unhealthy that the only words that I could use to describe it was it was very much like ground beef. The tissue was just so broken down. The collagen was just so broken down, and there was so much bleeding. She saw every doctor you could imagine. No one had anything to offer as far as helping her. She tried every prescription, every rinse, nothing helped. Finally, I just threw my arms up and I said, you need to use the torch. You need red light in your mouth. And she's local to me. So thankfully she was able to come over. I showed her how to use it. And within a week, she sent me a text and said, this is the first time in over 2 years that I haven't spit a sink full of blood every morning.
Wow.
Light is fast. Light works with 100% efficiency, and it's fast. You're not waiting for these biochemical processes to hopefully take place. It's instant. Light is fast and efficient. So, and over, I mean, there are so many stories within within our all of these groups. The torch has saved a lot of teeth. There were teeth that were, on the chopping block. They were scheduled to be extracted, and people reached out to me, and I worked directly with them and developed a specific protocol to them based on what I saw on the x-rays, what they had described to me, clinically. And I was able to provide them with an actual protocol that, extractions were canceled. They didn't need to happen. The teeth were saved. The teeth ultimately ended up self-healing, and they're fine. So red light within the mouth it's my favorite tool. It's my go-to for everything, obviously, but certainly dentally, it's absolutely my go-to.
Okay, question on just day-to-day use for someone.
Yeah.
Say someone that's suffering with plaque and they want to reduce how much they floss and all the effort they put into their teeth. How would they use the torch?
So first of all, if someone is a heavy builder, if they're building up a lot of plaque, if they're building up a lot of calculus, which is just hardened plaque,
Hardened.
and typically, as the patient, you know, you've heard those terms when you go for your dental appointments. You know if your practitioner has said, oh, you're a heavy builder, you build a lot of calculus, or you can even feel it like behind the lower front teeth is typically an area where
Right.
calculus builds up a lot. If that is the case, there is an issue within your environment. That is something time and time again that is directly correlated to your environment. That is a clear signal something is not right in your environment. And I know, you know, Corey and I have even had these conversations about plaque, about dental plaque, but also about arterial plaque. And is it serving a purpose? Is it there to protect you in some way? Is your body doing whatever it has to do to try to protect some very important tissues? So, you know, there's that's sort of always in the back of my head, like, it's there for a reason. I believe it's serving as a protection. That's an environment.
I always kind of thought, like, if someone's too acidic, you know, or they have, I don't know, acid reflux, is the plaque there to protect the teeth? I don't know.
Oh yeah. Well, it's an insulator. It's definitely an insulator,
It's insulator,
right?
yeah. Right.
Yeah. So, and it's ever present. That's what always makes me think, no matter what, if you come into my practice and I see you and I clean your teeth, the minute I stop, plaque is starting to build again.
Right.
This is an ever-present thing. So our mentality of like, oh, attack the plaque, we must remove all the plaque, attack the plaque. Nature designed for it to be there always.
So when you're going in for these cleanings every 6 months, like most of us do, you
Or
know,
3
and
months.
you're like, that is an area where I have buildup is in the back of my lower teeth. And when and then they clean it out and I can feel my actual teeth again.
Right.
And then it builds up again. I know
Right.
people are, okay, so I guess I have two questions. So the first question is, you know, is that being removed every 6 months a bad thing? Would you say maybe a teeth cleaning every year? Do you even want to clean that out? Like, what is your opinion?
No, I think if you're building up a lot of calculus, you do need that taken off. You
Mhm.
do need that
Okay.
cleaned out more frequently than not. But I believe that to be an indication that calcium is being displaced in your system. And that usually, and what we're starting to understand, is an environment issue. There's something that is causing calcium to be displaced. I've even seen patients that I know historically build a lot of calculus, and I've sent those patients for cardiac calcium scores, because if I can see it, if I can see the oral representation of that, that makes me a little suspect that that is happening in other places like arterial walls, where
Yeah.
you definitely don't want calcium to be displaced. I also, if I see someone that I know that I've seen for a long time, and I know my patients and I know exactly what their mouths look like. I've seen my patients for 20 years. So we have a long-standing relationship, and I know every one of their mouths and what is very typical for them. When I just all of a sudden see a patient that they present to me, and all of a sudden I'm seeing like this ledge of calculus that is not normal for them. My first question is, are you taking vitamin D? So there's another thing that vitamin D supplementation does. It displaces calcium within the system. So that's not something that we want to be doing. So,
Right.
you know, that's always like my first question is, are you taking vitamin D supplementation? And, you know, when I see these patients that the doctor put them on 50,000 IUs of vitamin D, and all of a sudden I'm seeing all of this calcium displaced, immediately I'm thinking like, what did they just do? You know, not a good
And I
idea.
know my second question there is, and you brought it up twice now, you say it's something in the environment.
Right.
And people are probably listening, well, what about my environment? What about my environment? Why don't you tell us a couple of things that you would ask somebody about their environment?
Well, typically that would be, you know, on a high non-native EMF environment that we know, I mean, the research shows that it does sort of open up those calcium channels that displace calcium within the system. And again, that's not just orally, that is systemically happening. So I certainly see a correlation in people that are in industries that are, not I would call it a safe environment, people that are tech workers. Certainly I usually will see a lot of calculus buildup, a lot of healthcare providers, I notice, tend to, we kind of have a running joke in our office that, doctors and nurses tend to have the worst oral health. That's something that we talk about in dentistry all the time. And everyone just kind of thinks that, oh, well, maybe they're not taking care of themselves. Whereas I'm the one thinking, I think it's their environment that is,
they're all under blue light.
Right.
For starters, right?
Right. Yeah.
Because they have to
Yep.
be able to see inside the patient's mouth or, work with them. Yeah. Interesting. Okay. On the environment, I think that's my last question. And then I wanted to ask you about the diet. Just, I don't know how much time we have, but, before that, quick question. I
We have about 10 minutes left.
Okay. 2 show and tells. Are you a fan of these
Yep.
little chewy things to help? Do you think?
I've seen them. I haven't taken that dive to research whether or not
It's a
good or
jaw
bad.
exerciser. Yeah.
Right. I mean, the human bite is unbelievable. I mean, we can elicit nearly 2,500 pounds per square inch within the human bite. So the tongue muscle and the masseter muscle, your chewing muscles, they're really strong muscles. If you're things like mouth breathers and you're actually changing the anatomical structure, I think maybe those could be a good thing.
Okay.
I haven't looked deep enough into them to give it a thumbs up or a thumbs down.
My dental hygienist is keen on this, and she calls it like a little tongue pillow where you stick it in your mouth. I don't know what they're called, but you stick it in the mouth, and it's like it just like rests. It rests while I'm here. There you go. I'll stick it in. So she wants me to, for a few hours a day to leave this in. No, you
Okay.
used it? No?
I have not looked at those either.
Okay. We'll move on then. So back to food, just to finish food. Okay. So if the parotid gland is like the pancreas gland in its function, does that mean we should be cutting sugar and maybe a lower carb diet would be wise?
Absolutely.
We don't have to overwork that poor little parotid gland.
Right.
Okay.
Which is just constantly trying to supply minerals, right? To help remineralize, because you've just demineralized and made the mouth more acidic by adding carbohydrates. But it's also the frequency at which you introduce carbohydrates into the mouth. So it's not only, what you're putting in the mouth, it's also how often, which again falls more into like our world of, you shouldn't be driven to eating all day long.
Right.
There should be set meal times. We shouldn't be grazing on food all day long. So it's what you're putting into the mouth, and it's the frequency at which that you're changing the oral microbiome. But definitely, eat, and especially like with kids, a lot of parents are concerned about what their kids are eating. Always default to protein. Protein, is never going to be a problem orally. So always default to protein. If your child happens to need a snack, then, or you feel like you need a snack, go to protein. It's never going to do you wrong. It's always going to be utilized, but absolutely, limit your carbohydrate intake, no matter what. Always limit your carbohydrate intake. Starches are very bad for the mouth, bagels, bread, pastas, things like that. Very bad for the oral microbiome. So, you're not going to go wrong with protein. Stick to cheeses and meats and things that are just much healthier.
Okay. And bone broth? Are you a fan?
Oh yeah.
The collagen helps.
Yes.
The
Well,
teeth?
and also, within the mouth, I mean, that's, that tissue is very collagen dense and very collagen reliant. So if you are someone where your doctor is telling you that you have periodontal issues, that's a collagen issue. That's a redox issue.
Okay.
Those are things that need to be built through lifestyle, but also can be supported and built using red light therapy. And that's why the red light, intraoral red light therapy is so beneficial, because it's acting directly on that collagen network, that water.
Okay, back to, I don't know if you answered it or I missed it, but with the torch, because we want to go back to this. That is your
Yes,
torch.
I
That
was
in
just gonna
episode.
hold mine up.
Okay, so yeah, you've got the attachment. I don't have the
So if
attachment.
anyone's watching this on YouTube, I'm holding up Kelly's torch, and it has an attachment on it for easy.
But you screw on
She's
to
holding
the
it up
base.
as well for easy access into the mouth to treat your mouth. So,
Do you
good question, Laura.
Yeah. Do you, okay, tell us how to do it. And would you do it daily, twice a day? What would you
I
recommend?
would suggest, again, it's specific. If you're having an issue, if you have a gum issue, okay, you can take the tip of this torch, and I know Andeea has the red tip on it, the red cap on it. You would take the red cap off, and you would take this and you turn it on the very first setting, which is all the wavelengths, the red and the near infrared. Because you want all of the wavelengths, because the red wavelengths actually are very beneficial, just like they are for skin. They're very beneficial for the gum tissue as well. So very rarely do I make a recommendation to use only the near infrared in the oral cavity. Typically, my recommendation is to use all the wavelengths, which are the red, which is the first setting, which is the red and the near infrared. And then you can put this in your mouth, and I just have people walk it, just touch it directly on the gums, and just walk that torch all around your gum line, upper and lower, inside and outside. And you can do that once a day is usually sufficient, unless there's a much more serious issue. Then we would discuss like how you should actually be using it. But my son came downstairs a while ago. Mom, I have a sore throat. I said, oh, let me look. And I looked and I could see one of his tonsils was like very inflamed and kind of milky. And so I took just the tip of this torch, and I had him breathe through his mouth, because this can certainly, going back that far, can trigger a gag reflex. And I just rested the tip of that torch right on that tonsil for 3 minutes, resolved. Later that day, he came down and he was like, wow, my throat feels so much better.
No way. Oh my God.
Yeah. So, for like tonsillitis, this is a really, really great tool. Wow. Honestly, I mean, I've found there to be no limiting factor in using the torch within the oral cavity. Certainly for kids, if any kids tend to have tooth issues, usually through trauma. So if there's something that actually happened traumatically with the tooth, this is a really powerful tool for a child, for anyone actually. I work with some pro athletes that play some pretty intense sports, like some of the pro hockey players. There are oftentimes some dental issues with that. So, this is a really powerful tool to heal things like that. Yeah. And also with this, I think my favorite thing with this, aside from, all of its dental applications, I go to the third setting, which is the lowest setting. And this is 810 nanometer light. I isolated 810 nanometer light because the brain loves 810 nanometer light. So when I go to the third setting and I use this intranasally, that's like the brain just loves it. So like intranasal red light on that third setting, which lowers the intensity, because you want to kind of lower it. You don't need to blast intranasal light. But it actually requires much lower intensity when you're using it intranasally. Other parts of the body, you can, like if you're going to use it like directly on the tissue, certainly the first setting, full blast, is what you would want. But intranasally, you can go much lower power up the nose, and it's phenomenal for the brain.
Okay, I had a friend with a recent son had a traumatic brain injury, and so yeah, but I didn't know that. I was saying to do the two, like the 600.
And what? I mean, the thing is that that's okay.
Okay.
It's within my past couple of redesigns of the torch is when I actually, the 810 nanometers always been there. But I actually had them work on isolating the 810 nanometers. So I'm sure, with them using it intranasally,
Fine.
trust me, I've done enough intranasal light, and initially I did go for all of the wavelengths because they're all important. So, no issue with that. If someone's been doing that, up to this point, it's perfectly fine. I just personally wanted to be able to isolate that A10 nanometer.
Because I've heard that multiple times that the 810 nanometer is really good for the brain. So that makes sense why you wanted that.
Right. It is. The brain loves it. The brain loves all red light. It loves all red light. So, but they have isolated particular wavelengths. 810 nanometer happens to be one of them.
Okay.
Andeea, you wanted to ask about the Bristle, and my question would be the Bristle toothbrush. I know we don't have a lot of time left, so we'll be quick here, but just if you have the torch and you have, do you really need the Bristle?
I don't think so. That's my opinion. I think Bristle is a good brush. I think it's, if I'm going to recommend an electric brush, I think the Bristle is the best because I know that they've tested it for EMFs. And, they're a very reputable company. They're very good people. They make a very good product. It sort of depends. I have many people that have the Bristle and also have the torch. They're different products, and there's different power from what they're using for red light, which is good, and it's different power compared to what the torch has.
It would be lower power, right?
Mm-hmm. Yeah. Which it should be, right? It should be if you're using it as a toothbrush.
Exactly.
So yeah. So it's designed exactly how it should be designed, and it is a great product, and I love it and I support it. But yeah.
Cool. Okay, Kelly, we are at our signature question. So I know you've answered what does quantum healthy mean to you before, but from the lens of this episode being more focused on the mouth and on dental, how would you answer that question?
It's these quantum principles that are going to gain you the health within the oral cavity much more so than any other medicament or modality out there. Living quantumly basically takes me out of the equation. Living quantumly, you don't need me. You don't need a dentist, honestly. Right? So that should be the goal. Our goal for everything should be to stay out of these offices, stay out of these practices, whether it be a medical practice or a dental practice. The goal is stay away, let the body do exactly what it's supposed to do, but it's up to you to give it the support and the input of information that is required for it to do its best job for you.
Yes, that's wonderful. I love that point.
Awesome.
Answer better. I like when you asked me the first time, the other in the red light one, I like that answer better. But specific to dentistry, stay away. Do whatever you have to do to not need us.
Kelly, how can people find you?
They can find me. I'm on Instagram. I have 2 accounts. I have at the Quantum Mom or at Soleil Well, SOLEILWELL. Soleil Well is my red light company, and the Quantum Mom is me and health and wellness and dentistry.
Is there anything we missed, Kelly, that we should ask you about? Okay.
I think we pretty much blew up dentistry. So.
Yes, we did a great job. You did a great job.
Can we officially ask you to come back again, because we have tons of questions on all the conditions and interventions and go a little deeper on all those. Yeah, we'll just see when our schedules line up. And
yeah, absolutely.
Okay.
One thing I do want to add, and a question that I do get so often, is the correlation between root canals and breast cancer.
We're going to ask you that one.
Yeah, I absolutely want to address this because this is something I get asked so often. I will not align with that way of thinking. That is such a reductionist way of thinking. I think it's very simplistic to think that a root canal caused your breast cancer. Low redox caused the breast cancer. Low redox caused your tooth to fail, which then caused you to need a root canal. And the downstream of that was a bigger diagnosis. So I think for people to be thinking and for biological dentistry to be promoting the narrative that root canals are causing breast cancer, that's an incorrect narrative. And it's a bigger issue. Light is the bigger issue. Lifestyle, low redox. That's what needs to be addressed, not so much the root canal.
So people need to gather electrons, keep those electrons, stop
Yes.
losing electrons. I like to, I've been telling people lately, it's just, you just imagine you're a bucket and there's a whole bunch, you've got too many holes, where can you plug those holes and stop the leaks,
Right.
and then pour more water into the bucket so we can keep the bucket full, and I don't know, that's my latest redox.
I'm waiting for someone to create a game for children, a game based on gathering electrons. Your day is based on gathering. How many electrons can you gain
Yes.
throughout the day?
That's the analogy I love, or the money analogy.
Okay.
Like that, that's how I teach it. Exactly. It's like a game. I think of Leonardo DiCaprio in that movie, The Beach, where he's hallucinating and he's running through and he's got all the points collecting above his head. It's like that. That's how we need to, we're spending that money all day long. And if we think of our money as energy, what's the game? How can we collect those electrons? What can we do? What are the simple little things? How can we sneak some in? Because all day long, we're spending that energy.
You don't want to go into debt.
And we don't want to go into debt. Exactly.
Love it.
This is wonderful.
Thank you, Kelly. A few things I want to share.
Amazing.
Oh, this was so fun. Here, listen, thank you for studying all the quantum biology that you have to the depth that you have, and then really acting on it, finding the truth and acting on that with Soleil Well, and then just everything you're sharing with your patients. Thank you for pioneering quantum dental hygiene. Thanks for giving us the torch.
Yeah.
All its uses, it's really, as you've said, it's like a first aid tool and a preventative tool, right, for the mouth. And then I didn't know if you'd bring out some quotes today. I call them Kelly quotes, but I want to thank you for these couple of quotes I've heard you say before. Every minute you spend outside is a minute longer you will live.
Yes. Doesn't get simpler than that, right?
Yep. And the other key one I love is seek the light to keep the light.
Seek it to keep it. Yep.
Simple quantum practice.
Right.
Great. Awesome. Thank you so much, Kelly. And thank you, everyone.
Thank you so much for listening to the Quantum Healthy Podcast. We hope you found some value in this information. And if you feel inspired, please share it and leave us a 5-star review. This will help us reach so many more people. If you want to connect with Laura, you can find her at laurakistmanwellness.com and Andeea at andeearay.com. Links are below in the show notes. Now, go find some sunlight and embrace your own quantum healthy.